Okay, hi everybody. So I want to talk again about the coronavirus. Hardly seems worth talking about anything else at the moment, does it? Seems kind of weird to talk about anything else, really, even though I know that means this video will get demonetized and nobody beyond my subscribers will ever get to see it, because that's how YouTube is managing this, quite understandably in many ways. But nevertheless, I think for those of you, my subscribers and patrons, you may find this of interest. What I want to go through in a couple of minutes is this document from Imperial College London, which is being quite influential. It's not peer-reviewed for obvious reasons. There's a lot of very eminent people involved in this, a lot of groups contributing to this. But obviously they haven't got time to go through that. This is information that's needed by governments now, and this is a document that is, I'm told, has influenced the US government's change of heart, because it's about modelling it for the US and the UK, and has very definitely, explicitly changed the stance of the UK government. So I want to go through that, because having read all of this yesterday and gone through it twice, I've spoken to a number of people I work with, people I'm related to, and some friends, and it's amazing. Even though they're following everything on the news, really up with this as most people are, this is all news to them. And probably for very good reasons, the government aren't going through this in detail with us, even though it's publicly available, because people are getting a little bit antsy and freaked out about some of this. And that's maybe the first thing that I want to say before I move on to that, is please don't panic. Some of what I'll talk about here is stuff that it's not stuff to be frightened by, but it's something to get your head around, because I think some of the changes that we've seen and that we are going to be seeing in the coming weeks in the way that we live our lives are going to become the new normal. If you are labouring under a misapprehension, and that is what it is, that, well, my government says they're going to revisit these strategy in a couple of weeks at the start of April, and then maybe the lockdown measures are going to end. The suppression strategies that are taking place now may be in place on and off, most of the time on, for between 12 and 18 months. So these are sobering facts to start getting our heads around, as you'll see when I read the report. But don't panic. That's the biggest danger at the moment, I think, is the panic that is taking place. We were seeing it in shops in the UK, and it's terrible. You can be the cause of some old person not getting the stuff that they really need, and there is no need for any of that. This will all become the new normal. The shelves will still be stocked, and we will carry on. I am quite certain of that. I'm filming this now having returned from work. I work in the fire service, and I think probably what I've seen at work yesterday will be repeated across the emergency services in the UK and beyond, which is a real positivity on behalf of both the management and the workforce to keep things running and to do what is required, and in both camps to do things which would not take place under normal circumstances. The normal rules where everything is nailed down and there's very procedural ways of doing everything, it's all up in the air now, and we'll do what we need to do to keep providing the services, and I'm sure that will be iterated, in the health services, in the police service, amongst lorry drivers, amongst farmers, amongst all these critical groups that will keep the food running and keep everything going. Okay, I want to go on with the report. Just let me say before I do, I've seen a number of people really laying into Boris Johnson, calling him an idiot and a buffoon over the way that he's handled this, and now saying, at last he's listening to the experts and doing what they say. And I feel a bit sorry for him. He's a guy who sometimes is a bit of a buffoon, but on this occasion he has been following the advice of these experts, the UK experts who are modelling what they believe is going to happen in the UK, looking at the situation, laying out models for the UK, for the structures that we have, and working on their advice. And what has happened is their advice has changed, and he was working on their advice, and now they've said, you know what, we've had another look, we think our strategies were wrong, we're revising it, you need to revise your approach. And immediately the UK government has gone, right, that's what we'll do then, we will revise their approach. It's kind of, I feel a bit sorry, because the amount of times we knock our leaders for not following their scientific advice. And if he's a bozo or an idiot for following the scientific advice, then all these eminent immunologists, etc., are bozos for giving that advice, I would say. So that's my thoughts on that. But let me talk about what we've got here. There's some interesting graphs and information to show you here. What we've talked about before, what you've heard on the news, bear in mind, I'm not an expert on viruses or immunology. I'm just reading and just giving you the information that was in here. But what they've talked about is this containment stage and a delay phase, and working to that kind of a model. And this was all part of a mitigation strategy, which was effectively that it's a big call to try and suppress these things, as it turns out. So what you can do, the other strategy is a mitigation strategy, where you allow it to come out in a controlled manner, a manner that you can handle, but you allow people to catch it, the right people, the people who can cope with it, whose immune systems can cope with it, and then you develop that kind of herd immunity and you allow it to pass through the system. There is another strategy, the suppression strategy, and that is effectively what the US and UK have changed from trying to take a mitigation strategy to a suppression strategy. Let me read for you what it says. It outlines the details of these two strategies. A, suppression. Here the aim is to reduce the reproduction number, that's the average number of secondary cases each case generates, R, to below 1, and hence to reduce case numbers to low levels, or, as for SARS or Ebola, eliminate human-to-human transmission. The main challenge of this approach is that NPIs, and this is what they're talking about, non-pharmaceutical interventions, and drugs, if available, need to be maintained, at least intermittently, for as long as the virus is circulating in the human population, or until a vaccine becomes available. In the case of Covid-19, it will be at least 12 to 18 months before a vaccine is available. The mitigation strategy, which is what they've moved away from. Here the aim is to reduce NPIs and vaccines or drugs if available, not to interrupt transmission completely, but to reduce the health impact of an epidemic, akin to the strategy adopted by some US cities in 1918. Of course, that was the Great Spanish Flu epidemic, and by the world more generally in the 1957, 1968 and 2009 influenza pandemics. Then it says the strategies differ in whether they aim to reduce the reproduction number R to below 1, suppression, i.e. for each person who has it, they infect less than one other person on average, so it gradually declines. And it says, and thus causes case numbers to decline, ultimately slow spread by reducing R, but not to below 1. So that was giving you a bit of an outline there of the two things, and you can see immediately you need to brace yourself for this. This suppression thing isn't something you just do for a handful of weeks and it declines down and that's the end of it. And it'll show you the graphs of that a little bit later. But let me show you this table first. This table may be a reassurance to a lot of people watching this. I suppose it was to me. I've got an 80-year-old mother with COPD, but she's going to totally isolate. I will help her isolate. So my concern was also for me and my wife and I, who are in our 40s, and also for our child. So this is showing age group, and it's showing percentage with symptomatic cases that require hospitalisation. Bear in mind there are a substantial number, they think, of asymptomatic infections, especially amongst the very young. Then the percentage of hospitalised cases that require critical care, and so that gives you a fatality ratio. You can see amongst young children under the age of 10, the fatality ratio is very, very small indeed, even amongst symptomatic cases. In my kind of age group, if you're under 50, 40 to 49, it is 0.15% there. So what's that, about 1 in 600, 1 in 700, something like that. Okay, if you're in the 80 plus category, then shit gets real. 27% of those with symptoms require hospitalisation. 70% of those in hospital will require critical care and a ventilator. And the death rate, the fatality ratio, is almost 10% there. So that just gives you an idea of where we are on this table. And I know the governments have talked, and everybody's talked about the fact that it affects older people more. That gives you an idea of the kind of numbers that they're talking about. What they then did was a little bit of modelling, which I thought was really, really interesting. So let me show you this. And well, before they did, they just outlined some of the interventions considered and they were case isolation in the home, symptomatic cases stay at home for 7 days, voluntary home quarantine following identification of a symptomatic case in the household. All household members remain home for 14 days. Social distancing for those over 70 years of age, so therefore the greatest risk of death, and also for requiring critical care units, ventilators. Social distancing of the entire population, so that's scaling that up to everybody, and closure of schools, of universities. This is what they said results, before I show you the peak. In the unlikely absence of any control measures or spontaneous changes in individual behaviour, we would expect a peak in mortality, daily deaths, to occur after approximately 3 months. In such scenarios, given an estimated R of 2.4, so that's each person infects 2.4 people, we predict 81% of the GB and US populations would be infected over the course of the epidemic. Okay, so that's kind of what we're looking at there. And then they showed you the graph here for Great Britain and also for the United States, and you can see how it reaches quite a peaky peak, which was obviously one of the considerations with the original strategy, right, which was to try and flatten that peak out so that emergency services and all the people that we depend on beyond that, and there's so many of them, people working in supermarkets, in the food supply chain, in the medical pharmaceutical chains, would be able to manage their working populations and keep things going, to try and bring that down. But this is the scary thing. For an uncontrolled epidemic, we predict critical care bed capacity will be exceeded as early as the second week in April, with an eventual peak in ICU or critical care bed demand that is over 30 times greater than the maximum supply in both countries. So if you want to see a sobering graph, have a look at this one. This is showing you a window here. This is for a 3-month intervention strategy, the mitigation taking place over the key period to try and bring those curves down. The black line is the do nothing. The green line moving down is the closing schools and universities. The line below that, the sort of orangey line, is case isolation. And then the yellow line below that, case isolation and household quarantine. And then finally, case isolation, household quarantine, and social distancing of over 70s. These would also all flatten down that reproduction number, but not to below 1. So it's allowing it to peak, but it's flattening the curve down. The sobering thing is that red line at the bottom, hiding there at the bottom, which is the surge critical care bed capacity. These are many, many times over it. It says here, in combination, this intervention strategy, this is the blue line, is predicted to reduce peak critical care demand by 2/3 and halve the number of deaths. However, this optimal mitigation scenario would still result in an 8-fold higher peak demand on critical care beds over and above the available surge capacity in both GB and the US. Okay, so that's what they're saying. And as a result of that, is that they said that this isn't really an acceptable strategy. Looking at that, it's just it's giving them a little bit of a nosebleed, and so what they're looking at then is a suppression strategy. And what suppression strategies involve, it appears, according to this, closing schools and universities is not a very good, it doesn't have much effect on mitigation, apparently, because to mitigate it, really, in terms of those critical care beds, it isn't the people that are going to university and school that need them, it is the older folk. So if you've distanced your older folk from the younger folk, it doesn't really matter so much if the younger folk get it, whereas if you allow them to come home, actually, the younger folk could be in more contact with the older folk, and so that mitigates some of the benefit of the lower social contact factor you're getting by children not passing it to other children and taking it into other households. But it does have a good suppression effect because it is stopping it passing from household to household. So in terms of suppression, closing schools and universities is a big thing. This is why there was such a big thing. Why isn't the government closing the schools and universities? It was because in terms of a mitigation strategy, it wasn't particularly helpful. In terms of a suppression strategy, it will have a place, and those measures will therefore come in now. They need to be timed at the right time, but they're coming in. So that's important. And general social distancing is the other one. So that's everybody keeping away, not going to work unless you have to, going to shops a couple at a time, only going to shops if you really have to, all these kinds of things, limiting all the social contact that we can. Those two factors are the factors which, added to these other things, apparently, according to their research, can take that reproduction number below 1. This is the problem. So let me show you this graph here. So this is showing you do nothing. It's showing you case isolation, household quarantine, and general social distancing in orange. And it's showing you school and university closure, case isolation, and general social distancing in green. So that's two methodologies there. And you can see how effective they are. Bear in mind, look at the time scale. This is for an initial lockdown period, if you like, of 5 months. Forget about the fantasy world of the beginning of April or maybe at the start of May. This is looking at 5 months. Even if you hold it for 5 months with a suppression strategy, the problem is that once you release that suppression, bang, it's going back up again. And there's the red line. You're still exceeding that red line massively just with these strategies. This is showing you another graph there, and the bottom graph is showing you the same strategies, but it's showing you the finer detail on that initial period and how that would work. So I hope you can see from this is that it's a bit of a problem. This is what it says here. Once interventions are relaxed, infections begin to rise, resulting in a predicted peak epidemic later in the year. This is important. The more successful a strategy is at temporary suppression, the larger the later epidemic is predicted to be in the absence of vaccination due to lesser build-up of herd immunity. So it's like you can't do right for doing wrong. The better your suppression strategy, the bigger the problem you're building up for the point where you release that suppression. And so effectively what they're suggesting is something like they show on this little graph here, which is that you can adapt a scenario where you have a series of periods whereupon you have these sort of lockdown conditions, but they're not convinced that you can maintain these things. It's for the economy, for people's sanity, especially if you're old, right? If you're 80 years old already and you maybe only got a few years left in the tank, the idea that you're not going to see your family for the next 12 or 18 months is frankly a difficult thing to entertain. So they're talking about sort of relaxation periods where we let the foot off the foot brake for a couple of months, and the feeling is that maybe people are more likely to stick to it under those conditions as well. So what it says here, to avoid a rebound in transmission, these policies will need to be maintained until large stocks of vaccine are available to immunise the population, which could be 18 months or more. And then it says this, however, we estimate that for the national GB policy, social distancing would need to be enforced for at least 2/3 of the time until a vaccine was available. Okay, before I have a few comments on this, just let me read you part of the summary here, a few paragraphs here. I think they're really enlightening. Perhaps our most significant conclusion is that mitigation is unlikely to be feasible without emergency surge capacity limits of the UK and US healthcare systems being exceeded many times over. In the most effective mitigation strategy examined, which leads to a single relatively short epidemic, case isolation, household quarantine and social distancing of the elderly, the surge limits for both general ward and ICU beds would be exceeded by at least eightfold under the most optimistic scenario for critical care requirements that we examined. In addition, Even if all patients were able to be treated, we predict there would still be in the order of 250,000 deaths in GB and 1.1 to 1.2 million in the US. In the UK, this conclusion has only been reached in the last few days. This was published the 16th of March. With the refinements of estimates of likely ICU demand due to Covid-19 based on experience in Italy and the UK, previous planning estimates assumed half the demand now estimated, and with the NHS providing increased certainty around the limits of hospital surge capacity, we therefore conclude that epidemic suppression is the only viable strategy at this current time. The social and economic effects of the measures which are needed to achieve this policy goal will be profound. Many countries have adopted such measures already, but even those countries at an earlier stage of their epidemic, such as the UK, will need to do so imminently. Our analysis informs the evaluation of both the nature of the measures required to suppress Covid-19 and the likely duration that these measures will need to be in place. Results in this paper have informed policy making in the UK and other countries in the last weeks. However, we emphasise that it is not at all certain that suppression will succeed long term. No public health intervention with such disruptive effects on society has been previously attempted for such a long duration of time. How populations and societies will respond remains unclear. Okay, my thoughts on this. This is something that we're going to have to get our heads around. Governments aren't outlining this, and you can probably understand why. I think they're hoping that let's get over the initial panic that things are changing, and once people accept, well, actually there is food still arriving on the shelves and everything, then they can start to sort of let us know that actually this is going to take a fair bit longer, and there's going to be a fair bit more of this than you realise, and that this is going to have to carry on. This isn't something we can just do until magically, well, China's done it, South Korea's done it, and that's it. No, it isn't it. They've done it, and they might relax it for a bit, but if they just relax it, it'll just go back up. They have to keep these measures in place. They have to keep measures in place until there is a vaccine available. If what is being said here is true, and these are some of the most eminent immunologists, the UK is one of the world's eminent centres for this, and this is their best minds working on this. It's not a bunch of idiots making videos on YouTube here. And one of the things this throws into relief, I think what will happen, my prediction is that a strategy is going to run along the lines of 4 months on, if it's a 2/3 thing like they say, 4 months on, 1.5, 2 months off, 4 months on, 1.5, 2 months off, to give us a chance as a society to have a little bit of normality, a chance for things to run, for us to go out the house and do things, I think. And also for the fact that it's the only way we'll probably sustain it. Otherwise, we'll just start slipping and we'll just get sort of blasé to it, I think. And I think that's a fair call, if that's how they're looking at it. What is particularly interesting is that those of you in the UK will know the government has made a really, really big thing about needing more ventilators, and they have got in touch apparently with all kinds of major engineering people to say, is there any way that you can help us to build ventilators? And honestly, I don't know how that works. My immediate thought with that is, well, I like the idea of it, but how if you run a car plant? You go from these machines that are just made for building cars to building ventilators, these very, very high-tech ventilating machines with all bespoke electronics. I don't know. That's an incredible operation. Surely you need an entirely different production line. So I don't know quite how that works, but apparently that's happened. John Bamford's, who makes sort of diggers and all that kind of thing, were one of the first people who came out and said, yeah, the government, we've been talking to the government in some depth, we'll help however we can, and apparently that's quite, it kind of triggers in my mind's ideas of a kind of big ventilator in JCB yellow, a 900 horsepower diesel diesel powered ventilator that, if you turn the dial up more than just a little touch, blows the patient's lungs out or something like that. But yeah, even people like JCB getting involved with this kind of thing. And I wonder if the government is looking at a kind of strategy saying, well, look, we have 5,000 ventilators now. Maybe if we can double that number, because in terms of critical care units, it doesn't need to be a fully fledged critical care unit according to the government. It just needs to be a critical care unit with the ventilation. It needs the ventilation capacity of a critical care unit. So maybe if they're thinking if we can have another 5,000 of such things in 6 months' time, who knows? Maybe that's not possible, but maybe if it is, then it alters the balance. And maybe the mitigation factor, the fact that some people are already infected by then, maybe you could start drawing those lines to within a more tolerable margin. I don't know how you get that mitigation line if you went from a period of suppression then mitigation down to that critical capacity, given that the best estimates at the moment are exceeding it by 8-fold. But maybe hard decisions have to be made. There is a cut-off point. Because, let's be honest with this. I know there are a lot of people, I have friends on the left who have accused the Tory government of murdering 100,000 people due to the policies of the past 10 years. And you know, these are policies where it's not putting the resources into the public sphere. Okay. And look, the amount of money that is getting absorbed here, there's a budget with 200 billion, there's another 300 billion. We're going to chuck billions and billions for this. This is getting 30 billion for, you know, it's just, these are sums that make one's nose bleed. And this is just in the initial period. I don't know whether that's going to sustain for 12 or 18 months. That's going to have a knock on. And there comes a point where you look at the amount of deaths caused by the amount of debt that has to be accrued through funding suppression over that period of time. The sheer number of people that they will be asking to stay at home and not work for that period of time. Supporting organisations like airlines, which can make huge profits, but they make losses at a bewildering, scary rate when all the planes are grounded. You know, it doesn't bear thinking about. You can soon get to a tipping point, perhaps, where over the next few years, more people die as a result of the concessions you have to make down the line because of how much this has all cost, than the people that have died because your mitigation strategy has exceeded your critical care bed use. Again, horrible decisions that have to be made, but maybe that is the plan there. With those ventilators. Let me also show you this. I'll just flash it up on screen. They're talking now about, once again, about the football, and this just shows how these impact on things and on how it might impact on football clubs, and that's what they're talking about in this. And it kind of amuses me. They're talking about the losses. Put it in terms of this, right? The initial situation was all the leagues closed down. Association football leagues closed down across Europe. Same situation is true in the United States with the NBA, NFL, the baseball, the ice hockey, all that. They all closed down. And it's like, well, how long? Is this just going to be for a few weeks? Will we be able to finish the season? Will the Premier League finish their season? And now the European Championships, European Football Championships, have been delayed a year. It's a strange situation now. Some people were saying, well, we might not be able to finish this year's seasons and we'll just have to start afresh in September. It seems kind of naive that. The ironic thing is that we might actually finish this year's now, because we may have a period of 4 months of suppression and then a little window where it's like, yeah, go play some football games for a couple of months, and then we're suppressing it again. Ironically, we might finish this season and the entirety of next season is written off, because for a 12-month period, or a predicted 12-month period, the populations are going to be largely locked down for most of those 12 months. You know, that is what we are talking about here. So I think that's what we've got to start getting our heads around. Most people you talk to don't know any of this and have no concept of the scale, but this is the research document from the research groups that is informing the UK and US governments that they are working to, and this is what they are saying is going to happen by their predictions. So if there is anything to go on, this is the thing to go on. Okay, let me lead you with just a little bit of positivity, and just to say that having come, like I say, from a workplace, I've never seen an attitude like it in terms of both sides, and having a positive attitude to having to come into work when maybe do several days work at once if it comes to it, you know, doing all manner of things which you wouldn't normally do in terms of the workforce and in terms of the management being much more open-minded than they ever have been. And I hope that we're going to see this all over. I think we are. My wife works in the teaching sphere. There is talk there in the UK with regard to closing schools, and this seems an eminently sensible thing. The big thing is those kids in year 11 and 13. It's UK talk, but that's GCSEs and A-levels. Of course, you need your GCSEs to see where you go in your future, and the A-levels are what you need to get you into university, to maybe closing schools apart from for year 11 and year 13 for the remainder of the year, so they can get their exams out the way. And that would seem a very, very reasonable thing to do, because what we are learning in all of this, what we're seeing in so many different spheres, is just how our society has absolutely no slack in the way that it stacks up. One thing goes on to another, goes on to another, goes on to another. And you only have to suspend society for a couple of months. And it's like if you've ever watched in the bike race where the peloton, maybe the Tour de France, 180 riders all going down the road, pelting down the road, and one rider clips another rider's wheel near the front, and all the way down the line, riders collide into the back of one another. There's an incredible knock-on effect. And that is what seems to be happening here in so many different spheres. As one thing falls down, this leads to this, leads to this, you know, and we're going to have to start thinking outside the box and showing the kind of flexibility and versatility that our systems have evolved out because they haven't needed them over the past few decades. Okay, I hope that's been of interest to some of you. I don't want to worry anybody. Don't bother panicking because it won't help you. Don't bother panic buying because all that will do is be deleterious to other people, and it isn't necessary, for crying out loud. I am sure that everything is in place here. Some lorry drivers will book sick with this thing, and if enough lorry drivers book sick, the army will drive the lorries. You know, the farmers can still farm. They're out there in the countryside. There's always people that can stack shelves if needs be. Let's be honest, the supermarkets will draft people in who are working in the restaurants who now can't work and have them doing that. We'll get through all of this. You'll get the bits that you need. The biggest worry is people panicking, I think, right now, for the next few weeks until this becomes the new normal. And then I think we'll get our heads around it. And it'll be at that point that everybody starts learning about this, because it'll be at that point they'll think, okay, now it's time to sort of just break this news gently, that this is going to go on for a little bit longer than people think. Okay, interested to know what you think. Thank you for watching. Hope this has been of some value. Take care. Take care of yourself and everybody close to you. Bye for now.